Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is what you need to know about lumbar sympathetic blocks. Now, a lumbar sympathetic block is a procedure used to relieve pain in the lower extremities from several neurologic and/or vascular conditions. The sympathetic nerves come off of the spine and regulate a lot of activities behind the scenes, such as activating sweat, dilating blood vessels, the fight or flight phenomenon, and this is called the autonomic nervous system. Now, who does well with the lumbar sympathetic block? Well, there's quite a few diagnoses that can benefit. One is RSD and CRPS. Another would be phantom limb pain, post-herpetic neuralgia, shingles, cancer pain, pelvic pain, and non-operable peripheral vascular disease. The procedure is performed by having the patient lay on his or her stomach on an X-ray compatible table. IV sedation is typically received, and it can either be unilateral or bilateral if necessary, depending on what type of symptoms. Fluoroscopy is used for real-time X-ray guidance so that the doctor knows exactly where the needle is going. Oftentimes, once the needle is assumed to be accurately placed, dye is placed to make sure that the needle's not in a blood vessel. And then once it's deemed to be satisfactory, numbing medicine plus or minus steroid is administered. The pain management doctor may also use phenol, which is an alcohol derivative designed to provide longer lasting pain relief. Radiofrequency ablation can also be done. It ends up being like a pulsed radiofrequency procedure to try and provide longer term relief. Here's a picture so you can see the person's laying on the stomach. The needle's going around the spine. This is the disc here, and this is where the sympathetic chain is. So the numbing medicine and steroid or phenol is delivered in this area. Are there risks? There's a small risk of infection, nerve injury, bleeding, anesthesia, allergy. There's also a small risk of a dropped lung, depending on where the needle goes, and possibly some temporary numbness. Right away, patients will typically notice increased temperature in the leg, and the veins have a feeling of fullness. This is normal. It means the block was positioned correctly. A temperature increase of about 2 degrees Celsius denotes a successful position block. This says actually you are leaving pain. Enjoy the journey. What are the outcomes? Well, sympathetic blocks have been shown to be an excellent pain relief procedure for those with RSD/CRPS, and that's one of the first, the gold standards in the treatment of that. Oral opiates often don't help with these types of conditions like RSD and CRPS, so the blocks can be very effective at helping relieve or reduce the amount of opiates necessary for the condition. For someone who has RSD, there's so many options out there for treatment because not one of them really works well, and this is one of the best ones that we have. The objective with RSD is to stop the overactivity of the sympathetic nervous system. It's basically breaking the cycle is what it's described as. And if you can do that, then you can get somebody back into physical therapy, back into functioning and not going down this road of chronic pain and hopefully not needing a spinal cord stimulator. So it really has been a great procedure for a lot of patients. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics in the network accepting over 50 insurances and providing over 25 treatment options for patients with the board-certified doctors. Visit us online at midatlanticpainnetwork.com and then call us for scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.